Psychiatry versus psychology, both based off the DSM, diagnose conditions related to mental health disorders, offer treatment plans. A psychologist spends a 4-year degree. A lot of them get PhDs. There's also PsyDs. They do a lot of therapy interventions. Sometimes they're doing more research. Psychologists cannot prescribe medications. The psychologist will be utilizing different types of psychological testing. An older person who's getting evaluated for any sort of dementia or neurocognitive disorder, that would be a psychologist. You may send a kid, if you're wondering if there's some sort of reading problems, to address some sort of cognitive or processing problems. That would be a psychologist that would do that. On the other hand, you have a psychiatrist. A psychiatrist is someone who goes to medical school. 4 years in medical school, more intensive work in psychiatry and residency. Because of that difference, a psychiatrist is going to be able to prescribe medications. They may be ordering lab work, brain imaging, using medications in addition to therapy, looking over your medical conditions and how that may be affecting your psychiatric care, your depression, your anxiety. Psychiatrists will be taking all of your medical picture into account because those can be causes of what's actually going on. A psychiatrist also, by requirement, has to do therapy training in their psychiatry residency. Where a lot of this ends up changing is once a psychiatrist enters the workforce, most settings really promote their ability to do medication management because of financial incentives. If you're looking for someone to do just therapy and medication management, the most common setup you'll have is a therapist and a psychiatrist. And now you know the difference between a psychologist and a psychiatrist.